DocTalk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of All-Flex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier animals.
Hey folks, welcome to DocTalk. We're going to have a great show today. Dr. Jacques Fuselier is going to be with us, and we're going to talk about bacteria, bovine respiratory disease, and so much more. Thanks for joining us.
Bovolus Nasalgen 3 offers young calves unrivaled protection against devastating respiratory diseases, including IBR, PI3, and BRSV. And it has a unique blue shadow, so there's no second guessing which animals have been vaccinated. To up your protection, choose Bovolus Nasalgen 3 PMH, the first and only intranasal that protects against viral and bacterial pneumonia. Talk to your veterinarian and visit nasalgen.com to learn more.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thompson here with a special guest today, Dr. Jacques Fuselier. He is a veterinarian, has practiced many years. He is now a tech services veterinarian for Merck Animal Health. One of those people that when you are wanting answers to difficult cases or ideas to new approaches is one of those people that I go to, and he's a pretty busy guy, so to get him to sit down here and be with us is great. So welcome to the show.
Thanks for having me.
All right, Dr. Fuselier, when we start to talk about bovine respiratory disease, just kind of walk us through, you know, it's a complex and it's a series of events, but kind of just walk through a typical case.
Yeah, so the textbook case, if you will, there's something that's going to happen to this calf that's going to have some sort of immunosuppressive activity, whether that's, you know, stress, physiologic stress, or traveling stress, just, you know, diesel fumes, wind, you name it, that can dry out the respiratory tract, or a virus that they get. Those viruses often come before the bacterial infection, and that helps to immunosuppress this animal. And you know, these calves often have these bacteria in their normal flora of their upper respiratory tract.
So the bacteria that can cause respiratory disease are normal inhabitants of the nose all the time. They're there all the time.
They are, and some of them can cause disease and some of them don't. And so certain factors have to happen that stimulate those bacteria to become infectious, or pathogenic, as we call it. And once that immunosuppression happens, that allows it to get into the lungs, and then the bacteria start to flourish, and the body's reaction to that bacteria plus the toxins these bacteria produce cause the disease process that we see as pneumonia. So it's truly a complex, and the bacteria kind of finish everything off.
So what are the main bacteria that, I mean, most people have heard of them, but you know, when we cookbook it down, what are we really concerned about?
The top three, let's put it that way. The top three is going to be Mannheimia hemolytica, Pasteurella multocida, and Histophilus somni. And the one that's always stays around that fourth place, but is a player, is Mycoplasma bovis. So those are the ones that we commonly see when we do diagnostics and try to isolate which organisms are causing disease.
Okay, and so these bacteria go in, they colonize in the lung when they typically wouldn't, because we can't either expel them or we've created an environment where they've slid down into the lungs and now creating disease, correct?
Correct.
And then from that point forward, from once they colonize, what are some of the activities that are going to kind of bolster this fluid and the stuff that we see there in the lungs?
So what happens is the body recognizes these foreign invaders, and they send signals out. The body will. There's certain white blood cells that come in, neutrophils and macrophages, they're called, that'll come in it'll recognize there's a foreign invader, and it sends these signals through molecules we call cytokines, and that releases things that produce inflammation, leaky vessels, and so forth, and it causes some damage to the tissues, with the goal of creating a hostile environment,
Right.
so that the bacteria don't thrive in that environment. But it ends up causing some disease, some negative impacts to the lung tissue itself.
Right. So it gets back to that point of we want to identify and treat early, but when we treat, we actually can, if we have a really hyperimmune response, create more tissue damage.
Early on, absolutely. That's what happens. You know,
Yeah.
it's kind of like when I teach this at vet schools, I like to say, if you consider it like war, you know, that if we start out with the bombs and then we call in the snipers, you know, so the early reaction by the immune system is just to wreak havoc on that area of the
Yeah.
lung field.
Yeah.
And if we can control that better, then the animal does better in the long term.
Perfect. That sets us up for a show, folks, to talk about control treatment of bovine respiratory disease and diagnostics. We're lucky to have Dr. Fuselier here with us today, and we'll be right back.
Stressors that trigger bovine respiratory disease are all around. So when you spot BRD in your herd, turn to Zuprevo, the fast that lasts. Zuprevo is rapidly absorbed in as little as 45 minutes and lasts up to 28 days. Because in the race against BRD, you need to win. Ready, set, Zuprevo. In case of human injection, seek immediate medical advice. For use in beef and non-lactating dairy cattle only. For prescribing information, talk to your veterinarian or visit Zuprevo.com.
We know how expensive it is to keep and maintain heifers. What is also the fallout of those heifers if they're not the correct ones you're keeping and maintaining? We want to do as much as we can to get it right before we spend the money to impact our herd further down that road and keep successive females out of the wrong type of females.
Identity Beef. Contact your Neogen territory manager to test today.
Success in the cattle business hinges on a lot of different people playing their part, from the vet to the cowboy and the nutritionist to the feed truck driver. You rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to bimetabiologicals.com to learn more.
Valley Vet Supply sees the hard work and effort of you and your animals to achieve your goal of being a champion. And we're here to help along the way. To the cowboys and cowgirls, to the dreamers, we see you.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Jacques Fuselier. And Dr. Fuselier is a veterinarian in Louisiana. He has practiced for, wow,
10 years.
10 years, and is now a technical services vet where he can amplify his knowledge through Merck Animal Health to many of us that are in practice. Great resource for me, for a lot of veterinarians when we're dealing with tough cases. And we're talking about bacteria, and we're talking about respiratory disease. And when we're talking specific bacteria, you know, the viruses, we just kind of write it out. But with bacteria, we can treat with antibiotics.
Yeah, we have a few more tools in the tool chest.
Yep. So when we're treating with antibiotics, you know, I break it down into two: control and treatment. And control is really metaphylaxis, right? When we got cattle coming in, when do we use metaphylaxis, or why do we use metaphylaxis?
Yeah. So cattle are really good at hiding disease. And so it has to get to a certain point before they show the classic signs. And so when we commingle these cattle, when we buy some to bring to a feeding operation or to bring to, you know, new introductions to a herd, they're masking some of this disease, and we have no idea where they are in the disease process. And there's been some exposure. You know, there's some comminglings, kind of like, you know, kids in daycare. They're swapping bugs, and there's some disease that's starting to happen, and some of them are different phases. And the goal would be to try to reduce the amount of what we call subclinical disease that's entering this facility.
Yep.
And so what metaphylaxis does is it kind of puts everybody back on even keel. Those that are harboring infectious bacteria, it'll start to control some of that and reduce some of the spread and reduce the severity of disease in that individual animal. The goal is kind of the metric that's used for a successful metaphylaxis is if you have a 50% reduction in disease going forward. And so that's really what we're trying to do.
And it's important to understand that because we're talking about the dried out mucous membranes and things of that nature that allow the bacteria to get to a place where we don't want them.
Mm-hmm.
It's not that we're killing them in everybody's nose going through. We're trying to kill them in the lungs, in the places where they might be causing disease.
That's correct. Yeah, so a lot of times they're coming in, they're stressed. They had a trip and they hadn't had water for a while. They're thirsty, and so there's a lot of that mild dehydration in that respiratory tract really has a negative impact on the that mucociliary mechanism to help clear any of this stuff. And so the bacteria have a great environment at that point to really start to flourish. So we're trying to, if we can minimize the activity of the bacteria at that phase, then the cattle are better off down the line.
Absolutely. So when we kill those bacteria, then they let off their leukotoxins or endotoxins. So early treatment is important, right?
Mm-hmm.
Not for a lot of different reasons, but that's one.
Yeah. And so it's not just antibiotics that's doing it. It's not like a bomb that goes off and all of a sudden there's a massive release of these toxins, but it's part of the natural process that these organisms go through. And when the calf's immune system attacks it, they do release leukotoxins, endotoxins, and they all have a specific function on the receptors of the calf's lungs. And that causes a lot of disease damage to the lung and fluid. And if we can stop that early on, then we minimize that long-term damage that's done to the lung.
So the old question is that antibiotics don't heal the animal, do they?
They don't. No, they give the animal a chance to win this battle. So if the calf's immune system is compromised, all the antibiotics in the world is not going to help save that calf. What we're trying to do is reduce the population of bacteria so that the calf's immune system can overcome it.
Perfect. Folks, great information, treatment, control of antibiotics for bacterial infections in calves. When we come back, we'll talk about battling some of these endotoxins and leukotoxins we've been talking about. You're watching Doc Talk with Dr. Fuselier. We'll be right back.
Stressors that trigger bovine respiratory disease are all around. So when you spot BRD in your herd, turn to Zuprevo, the fast that lasts. Zuprevo is rapidly absorbed in as little as 45 minutes and lasts up to 28 days. Because in the race against BRD, you need to win. Ready, set, Zuprevo. In case of human injection, seek immediate medical advice. For use in beef and non-lactating dairy cattle only. For prescribing information, talk to your veterinarian or visit Zuprevo.com.
When a new calf hits the ground, the clock starts ticking. A belly full of colostrum gives them their best chance, but if they don't get any, time starts running out. That's when you grab a bag of Oxford Ag Colostrum in their patented feeding system. It's simple. You fill it with warm water, shake it to mix, feed it with a tube or a nipple, and you are done. No bucket, no bottle, no mess, and right on time. Ask for it by name wherever animal health supplies are sold.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight-shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it, though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
ValleyVet.com is your one-stop shop for your every animal need. From prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Jacques Fuselier, and we're talking BRD and bacteria. Dr. Fuselier is a veterinarian. He is from Louisiana. He is a tech service veterinarian with Merck Animal Health, and there's just kind of a normal cascade, right, as to what's going on with bovine respiratory disease complex?
Yeah, and where the bacteria come into play and so forth. So as as this complex is going down the line, you have immunosuppression and some level of dehydration and stress that's going on, and then you have oftentimes a viral invader, and the virus does start some of the damage and some of the preoccupy some of the immune system, let's call it, and get some inflammation going, and then that sets up an environment that bacteria can really flourish and colonize these different areas of the lung and start to cause the damage. And so that as it's causing damage, the immune system recognizes it and releases these, the white blood cells will release cytokines, which can cause increased inflammation, leakiness of the vessels, fluid into the lung tissue, and that's where it really starts to show in the cattle that they're having trouble breathing and the temperatures are high. And then until finally, if nothing is done and the immune system can't fight it, the bacteria win and the cattle die. So if we can target different sections of that cascade, we can help minimize some long-term damage and improve the efficacy of our treatments. So like if early on, if we can include something like a non-steroidal anti-inflammatory like Banamine, that helps to reduce some of the cytokine effects. So reduce some of the leakiness and consolidation in that lung.
Because it kind of just pulls that immune system back enough that we're not damaging ourselves.
That's correct. You get it will start the inflammatory process, but and normal factors come in later and stop that inflammatory process. But when there's too much signal going on, we can come in and help the body shut down that inflammatory process. Some inflammation early on is good, but too long is damaging to the animal. So coming in and with non-steroidals like Banamine to stop that cascade, or at least reduce it, is going to really help the animal as far as, how they're feeling and the amount of lung damage that's going to carry down the line. And then we add in an antibiotic. And that's the therapeutics phase of it. So one antibiotic's going to either kill the bacteria, one of them is going to just stop replication, different mechanisms of action based on the antibiotic that's chosen, all with the goal of stopping the proliferation of these bugs and the release of their toxins that are so toxic to the lung environment.
Yeah, it's important. And then, go back to the how do we get earlier in that cascade versus later is really getting to that, some of the identification and some of the new technology that's out there like SenseHub and things like that really helps a producer find those calves earlier.
That's right. And that's where we're going as an industry, is how do we increase our detection earlier on and get an earlier intervention in this disease process. And SenseHub feedlot is one of the things that Merck Animal Health has that helps the producer recognize earlier.
We had put it in a feed yard and it increased our pull rates, which we probably needed to.
Probably.
And it was earlier, and we actually saw an improvement in the case fatality rate. And I'm sure that it's because we're treating earlier and more effectively.
Right.
Because of it.
Yeah, that's what our studies show as well, and that's what it appears to be, is that we're able to get an interaction earlier on and not have that long-term lung damage that results in chronic disease and death.
Just tremendous. Yeah. Tremendous information, folks. A lot packed into a short period of time. When we come back, we'll talk about identifying those bugs that are causing us issues. You're watching DocTalk, and we're glad you joined us.
I'm Dr. Les Anderson. I'm a beef extension specialist at the University of Kentucky. The Alertus on-farm test has the opportunity to completely change the industry. A producer is enabled and empowered to be able to take the sample and run the test or tests at their leisure without scheduling anybody. And honestly, reproduction is the thing that we measure the least, and it's the thing that dictates profitability the most. The Alertus on-farm test will help us to identify cows that get pregnant early. It'll improve our efficiency tenfold.
I feel the use of genomics for cattle producers will be more widespread than we're seeing it now. I think we're just in the beginning stages of it. And I think a lot of people just see the side of the replacement females and increasing the predictability and future use of your females, because we all know the cost that it takes to develop those into a cow. The large side of it that folks miss out on is the use of genomics to predict the product that they're making every year, and in that I mean their calves. The feed yards are constantly after a more predictable product, a more predictable days on feed, a more predictable outcome on the rail. Through genomics, we're able to accomplish a lot faster what used to take multiple generations.
Identity beef. Contact your Neogen territory manager to test today.
It's the drive, the passion, the unbridled desire to be the world's greatest. It's the early mornings, late nights, and every hour in between spent grooming the next generation of champions. We're with you through the best times and the tough times. Seeing your horses through inevitable health scares and setbacks you never saw coming. Everything they deserve is here, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Jacques Fuselier, and Dr. Fuselier is a veterinarian, bovine veterinary expert. He is taught at the University of Illinois.
Yeah.
At their College of Veterinary Medicine is where I first met him and got to know him, and then he has moved on now as a tech service vet in Merck Animal Health, where he's out in the field. He's working with your veterinarians, Louisiana, Texas. Areas.
I had the privilege of teaching at LSU as well. So.
You taught at LSU, and so just it's like a textbook for bovine medicine and prevention. But let's talk about, so then, you know, you're at veterinary colleges and you're recommending, and someone calls up and says, well, we got terrible BRD.
Mm-hmm.
You know, it seems many times we kind of do that to diagnose it, right?
Absolutely.
But we have a little better tools.
Yeah. And thank goodness, because there's a lot of people that'll tell me, you know, my cow's dying from Histopheles.
Yeah.
Oh, how did you figure that out? But I can tell just looking at them.
Yeah.
Unfortunately, sick cattle look like sick cattle.
Right.
And the cause is hard to discern just by looking at them, like you said. So, you know, our diagnostics as an industry is improving fairly rapidly. So we're getting better and better at deciding which bugs were the ones causing the disease. And, you know, unfortunately for us trying to treat this, there's more than one at play. It's not just one bacteria is the only one most of the time. And so if we can really figure out which of those invaders are the ones that we can target, that's going to really help. So, you know, the mainstay is going to be necropsy. So any of them that die or that need to be sacrificed early in the phase of disease, to really get some tissue samples submitted to a diagnostic lab. They do all the tests that they need to do to try to, you know, look at tissue changes that would indicate a certain organism, isolating that organism, and all these things together. Couple that with the clinical signs that are seen at the yard, you can get an idea of what organisms we're after. And we can test some earlier on. You know, we've come a long way with molecular diagnostics. So you can send a swab in from a deep nasopharyngeal swab, things like that, and do PCR, different types of PCR to figure out which bacteria and viruses are there.
It just amazes me too now with PCR, because it used to be you'd send a sample and you'd wait a week.
Right.
And now we can take a sample, and obviously there's some interference with vaccine strains of viruses and things like that, but we can get a PCR back in a day.
Yeah, it's phenomenal.
It is.
And that's really beneficial, because earlier, I mean, just a few years ago, we'd send a sample in and we'd get results back too late to address what's going on now, and we'd have some information if it happens again.
But if I want to get to, you know, which antibiotics are working on which bacteria, that's going to take a little bit longer.
It does take a little bit longer. It really does. We can use a broad spectrum up front to try to get at least that process going. And then once we get these results back, they'll often do a sensitivity. You know, that once they isolate the main organisms that are at play based on the samples we send, you know, they'll expose it in different fashions to different antibiotics we have available to use in cattle in the United States, and give us an idea of which ones are more effective, if you will, for those colonies. And then we can use that information to to tweak our treatment protocol.
But it is important when you say they get a sample from maybe an animal that died that hadn't been treated versus one we've doctored 5 times.
It would be fantastic. And unfortunately, we don't always get that, but it would be, that's the ideal situation, because we can skew that bacteria population with multiple treatments. And so you will end up getting a picture from diagnostics that look like this is the organism or the group of them that's causing problems, when they're just the ones that survived all the treatments, but it's not necessarily the one that started the problem. So getting diagnostics in earlier is going to be, before all the treatments happen, is much more beneficial than some of these old chronic cattle that we're using.
Well, man, what a show. Thank you so much.
I'm glad to be here. Thanks for having me.
Dr. Jacques Fuselier. Remember, always work with your local veterinarian. And if you want to know more about DocTalk, you can find us on the web at www.doctalktv.com. I'm Dr. Dan Thompson here with Dr. Jacques Fuselier, and we'll see you down the road.
DocTalk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of All-Flex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier animals.